One of the key challenges is a recognition that health is no longer medical. It's going to take a significant paradigm shift, especially from those who have enjoyed leadership of the healthcare profession, that health is no longer medical. A healthy human being is not healthy anymore because he's taking drugs. He's healthy because he's keeping fit. He's healthy because he's eating well. He's healthy because he's avoiding toxins. He's healthy because he's drinking clean water. He's also healthy, especially for children and women, because he's educated. So many other things besides clinical care affect health. And that's going to take us a paradigm shift that goes from a balance of lifestyles, investing in other sectors, as well as continuing to maintain our investment in clinical care when all else fails. Because no matter what you do, sometimes all else will fail and people will fall ill. So when we promote social determinants of health, we are not taking away from the importance of clinical care, but recognizing that our knowledge of what keeps somebody healthy has expanded well beyond clinical care. So our paradigm shift in the training of the health workforce, our paradigm shift in the structure of the healthcare system, our paradigm shift in how we measure our investment in health. The most challenging thing is that paradigm shift and how to bring that paradigm shift together to ensure that people are healthy and they achieve life expectancy. And so the Sustainable Development Goal 3, it's not about medicine, it's about healthy lives and well-being. So for me, the greatest challenge in public health at the moment is to help countries with that paradigm shift, not just in training, but in financing, but the structure of the healthcare system, and also in population awareness of their responsibility to their own health.
Oh, world over, there is no doubt that a substantial amount of the work of the World Health Organization and the other agencies of the United Nations like UNICEF has had an impact. There are areas of the world where malaria, which for example is a major health problem, has been overcome. In Nigeria, we still are grappling with it, but the input of donors into vaccine development has helped a lot. So there's a lot of things that have direct and indirect benefits from the activities of the public health practitioner. And when I say that, I don't mean doctors alone, I mean nurses and colleagues in health education, nutrition, and so on and so on. There are many areas where the combined effort of practitioners in public health has had an impact, local, national, international, and I can go on and I can give examples all day long. There are many examples.
Public health started off at very early age. Some 2,000 years ago, Hippocrates and his colleagues started what we now call public health. And through that, they have set up new views, new approaches, new hopes, and new achievements for health on the community basis. The one that impressed me most was the fight against smallpox, and to see how eventually we were able to get rid of smallpox from Nigeria. Like other developing countries, Nigeria has had to build up its public health services. By no means are they reached the proper level that we want, but you can see many important changes that have been achieved. There was a time when smallpox was a serious epidemic disease in Nigeria and other parts of Africa and other developing countries. Nowadays, there's no more smallpox. Through the public health mechanisms that were put in place, smallpox is no more.
The Adetokunbo Lucas African Academy of Public Health is presented to the international community and the health community as a bridge institution. Nigeria is very unique, distinctly unique, in that it is a production hub for the health workforce. Nigeria has 52 medical schools. It has at least 75 schools of nursing. Nigeria is also unique in having 36 schools of health technology, one in every state. Sadly, or curiously, it takes you 2 years to produce, maximum of 3, to produce a CHO, which is the output of a school of health technology. It takes you less than that to produce an extension worker. But once the system absorbs them, it takes you 35 years to release each vacancy. So at this moment, we are producing across 36 states, 52 medical schools, and 75 schools of nursing. In addition, the international community is committed to producing another 1 million community health workers. Legitimately so, we understand that close to clients is about community. They are the frontline health workers. There's so much more they can do to make universal health coverage a reality by the year 2030. But there's no career pathway for them. So the Adetokunbo Lucas provides that career pathway in the first instance that allows a community health worker to accrue credits that enable them to actually aspire to be more than a community health worker, to aspire to have a professional career pathway, an academic career pathway, and an administrative career pathway. It's the beginning of a very interesting journey that will help us to ensure that we are producing fit-for-purpose health workforce from community to tertiary care. It will make our health system stronger, it will make service delivery more qualitative, and it will also mean that the kind of labor difficulties we have currently in our healthcare system, that means that because people have all vacancies filled and they have no clear pathway to improve themselves beyond where they are now, there's nowhere else for them to go. So we're looking to establish the Adetokunbo Lucas Academy as a bridge academy and also a service delivery improvement academy that allows healthcare to reach everyone and leave no one behind.
Public health has grown. When I started work in Ibadan, in the UCH, I was doing clinical medicine, which I enjoyed very much. You go to the ward, you find out what's the matter with the patient, you give him treatment, and in many cases, they recover and get better. But slowly I was pushed, partly by the advice of others, and also partly from my own thinking about it, that we cannot go ahead treating diseases that can be prevented. Let's look at an example. In the whole of the United Kingdom, there were at that time only 20 cases of tetanus a year. At UCH at that time, we were seeing 200 cases of tetanus in one hospital alone. And the disease could be prevented. The vaccine cost 6 pence, the old money that we used in those days. And if they were applied to people, those people who had received the adequate doses of tetanus toxoid would have been protected. But instead of that, children are not all children are brought in to be vaccinated. Adults have injuries and they don't treat them properly and so on. We have to understand that things that we want to happen, like the clearance of diseases in our own area, those actions are required by all the people, not just the doctors and nurses alone, but the people. If you don't want malaria in your household, you then make sure that your area is clean and you don't have mosquitoes breeding.
Although Professor Lucas is a professor of medicine, he was also quick to be part of evolution that was innovative and creative. It was very clear that as we move professionally from the theory of miasma, which is that disease is caused by smell, to theory of contagion, which is that disease is caused by bacterial contagion, we find ourselves in a time where disease and ill health is no longer bacteria, it's no longer contagion, it's lifestyles. There are things beyond the health sector. We find ourselves in the Sustainable Development Goals increasingly defining health in much more than medical or clinical. The training of public health also moves along that line as we acquire knowledge and generate the fact that we cannot keep people healthy in the health sector alone. And the health of a human being no longer depends on a doctor alone. It depends on the nutritionist. It depends on education. It depends on water and sanitation. It depends on many social determinants of health that are not contained in the health sector. The reality is that our training needs to shift in the same way. Health systems are also not a purview of doctors anymore. We have public health physicians, we have public health engineers, we have public health nutritionists, we have public health educators. We have a variety of mid-level and community health workers that are actually active in the preservation of health and healthcare. So health is no longer clinical.
Wealth is health, or if you prefer the other way around, health is wealth. Without proper attention to health, especially areas called public health, the community will not be able to achieve its goals. Workers will not be fit to work. Workers who are working may catch diseases that are life-threatening. So we need to give a high priority to public health so that people can be fit and well, and in that way they can be rich.
I worked on the presentation with Professor Lucas. I discovered that his knowledge was not just of medicine, his knowledge of presentation, his knowledge of software, his knowledge of the world was just as deep and precise as his knowledge of public health. He is revered in the College of Medicine. He has so many students pass through him. In fact, I am very distinguished to belong to a third generation of people that Professor Lucas mentored, from Professor Yediro to Professor Lucas to Professor Yejide, and so I'm actually at the bottom of that chain. That really sets the pace for me of diligence. It sets the pace for me of commitment. It set the pace for me of paying attention to detail. It set the pace for me of thinking well beyond what I was seeing, to think innovatively outside the box and to improve the quality and the content of what I was doing. He set the pace for me in terms of partnerships. If you go round public health from Timbuktu to Cape Town, from Nigeria to Somalia, from Paris to New York, from Geneva to Australia, Professor Lucas is an icon. Not just because he distinguished himself, but also because he enabled young people to also distinguish themselves in whatever they set their minds to do. And so his footsteps in the sands of time are just simply immeasurable.
There's nobody more deserving of having an academy or an institute named after him than Tokunbo Lucas. I mean, if I was to I could spend a whole day, in fact, on his 80th birthday, some of us came together and wrote a book to commemorate that occasion. Academy like this one would not only identify human and material resources necessary to improve and sustain public health, it will also help to identify research needs, specific and directed at our national problems. So an institute or an academy that focuses on training the right type of people to do the right type of jobs in the right type of places is one. Two, identify research and giving service. If there's an outbreak of cholera, for example, as it's happened in Chokoto, you'll be able to have people on the ground who know what to do. There's an outbreak of Lassa fever in Benue State, you know what to do, and so on and so forth. So there is a critical mass of human beings, of professionals of different levels that can be produced in such an institute, and such an institute would give credence to policies, government policies on public health and health in general and beyond, because public health is not just a question of physicians and doctors and nurses and so on looking after. So there's a wide range of things where this sort of institute will identify human and material resources needed and can attract international recognition.
To honor Professor Lucas is not a decision, it's a commitment. And so I don't think we decided, I think we are committed. To honor him for his commitment to try to reflect the commitment of a distinguished gentleman and an excellent erudite professor is not doable, not in an institution. His legacy is already reflected in lives such as mine. His legacy is reflected in his children, who are also having children that are doing excellently well and are committed. His legacy is reflected in his book, which is in an edition that very few books of public health can match. So what we try to do in the Adelukas African Academy of Public Health is just a small part of a bigger legacy that we all hope that we can fit into. What excites me personally about it, that God has also blessed Professor Lucas. He's blessed him to see the output of his commitment in his lifetime. Very few people are blessed in that way. So it's just a small part of a bigger picture.
I think Adetokunbo Lucas Institute is long overdue, and I think it will serve a useful purpose.
Our training of the health workforce needs to recognize this shift. Our practice of public health also needs to recognize this shift. Professor Lucas was far ahead of us in recognizing that shift.